So I'm just going to introduce the panels for the final session. So welcome back to Mike Diper, Executive Director of Children and Young People at Sport England, Tackling Inactivity. To Ollie Dudfield, there you are, Executive Director at the Sport for Development Coalition. We are working with Ollie and the Coalition to create a policy paper that develops evidence-based recommendations on enhancing the contribution of sport and physical activity to addressing the mental health and well-being emergency exacerbated by COVID-19. And then to Chris Jones, CEO of England Athletics. Chris has championed mental health, leading to the England Athletics, running the Run and Talk initiative, as well as being the first sport organisation to take part in the Workplace Wellbeing Index. And I remember it was many years ago now that Hayley and I met with Chris at St Pancras, wasn't it? Just to talk through some ideas about how we could work together. So it's amazing from conversations maybe that you're having today where that can lead. And the final session is very much just thinking about how we can continue the work that we're all doing and then embed it further into systems and cultures across the sport and physical activity sector. So, first question, direct it to you, Mike, if that's okay. So what are your reflections on the progress made since that first mental health charter for sport and recreation was launched way back in 2015?
Yeah, doesn't that feel a lifetime ago now? Really does. I think it came, for me, just at the right moment. And it was a really perfect catalyst to get the organisations across the sport and physical activity sector talking about mental well-being and mental health and raise the profile and need for better mental health. And it's fantastic that it's something like 500 organisations, including Sport England, are signed up to it. And so it was a great catalyst. What it has got us all doing is talking in our individual organisations, in the partnerships we are, more about mental well-being. It actually came, and maybe it was one of the things which drove this, it came ahead of Sporting Futures, which set 5 cross-government outcomes, one of which, really crucially, was mental well-being. And perhaps that wouldn't have happened without that. So that's really good. It's led to some great action. I think probably my final thought is it needs to, great we're talking. What more can we do? Because there is so much left to do. And actually after COVID, we know we need a real big push again, don't we?
Yeah, we do. And Chris, from your perspective, as one of the kind of front runners, really, organisations leading this work, what are you most proud of in terms of what we're achieving as a sector?
I'm really proud that leaders are coming out and talking openly about what is, in my opinion, a bigger risk, a bigger threat than some of the things that we've been through over the last 18 months. I look at my children now, 19, 16 and 11, and I see the pressure that they are under growing up in a society that obviously peer pressure puts on them. And I'm glad I'm not growing up in that era. Frankly, I think it was easier when we were younger. But as leaders, we've got a responsibility to create a safe space in our organisations, in our households, in our communities, to ensure that people know it's okay not to be okay. And I'm proud of that more leaders in the sector and across society in general are coming out and ensuring that people know it's okay not to be okay. I've got an anxiety disorder. I've had it since I was very young. I've always masked it pretty well, and unfortunately had to have some time off last year in autumn for a couple of weeks, and then I came back on a part-time basis. I probably should have taken longer, but I didn't, And, I think the positive coming out of that was I was able to talk more about these situations with colleagues and hopefully create that safer space. And I think that's the thing that I'm really proud of, that, we've all got a responsibility to lead from the front, all of us, not just in the workplace, but also in the household as well.
Thanks for sharing that, Chris, and that's kind of inspiring leadership example right there. I think we've talked a lot about leadership, haven't we? So obviously we've talked also about the challenges ahead. I don't think any of us quite know the impact of COVID, but we know that there's a mental health impact, and we know that there's a rebuilding job to do. So, Ollie, if I can come to you, how do you think sport and physical activity can support the nation to build back better?
Probably two thoughts. The first, I think if you go and speak to your bank manager and you want to ask them for some money, it's always good if you've got a sort of positive balance and you've got a good history of having some credit in the bank. And so I think in terms of defining the role that sport, physical activity, sport for development can play in building back better, on the back of some of the work around the mental health charter, some of the work over the last 5 years, we've got some credit in the bank to speak to some of the contributions that can be made. I mean, we see some of the modelling, even pre-COVID, community sport and physical activity prevented about 375,000 cases of depression, about 33 million psychotherapy sessions were reduced. So we've got some credit in the bank. So with that, the second thought would be that we articulate sport and physical activity has a role to play as, I'll call it a team player, in this broader sort of build back better agenda and levelling up. And the key role, I think, is around the multiple returns on investment. So just yesterday, the Minister of Sport and Civil Society was at a project in the Midlands called Empire Fighting Chance. And they quite effectively combine essentially mentoring, almost to a very light talking therapies with coaching and delivery of boxing in this case. So they're able to speak to a return on mental health and well-being across their participants, but also are able to speak to evidence around reduction in antisocial behaviour, evidence around supporting young people back into the pathways into education. So I think the role we've got to play, or the role this sector has to play, is one, we can take some of the credit we've got in the bank, both in terms of our wider contribution, but also getting our own sort of house in order around supporting mental health within sport. But most critically, the multiple returns on investment if we're looking to support mental health and wellbeing outcomes through sport. And for those that we might be trying to bring into our way of thinking, it offers them not just one return for either individual, organisational or financial investment, but multiple returns on investment. I think that's the critical role in building back better that this sector can play.
Yeah, that's really interesting and really thought-provoking. And Mike, you talked earlier about the new strategy. So what's at the heart for you at Sport England in terms of thinking about how strategically we build back better, and you support that?
Yeah. So it definitely builds on what Ollie was just saying there. I think at the heart of it is truly trying to tackle the inequalities which exist out there. So the people who were already less likely to be active, people on low incomes, some disabled people, black, Asian, other diverse communities. It's about really reaching out to them, and I passionately believe that sport and physical activity can do it. I think it will do it by not parachuting things in, not top down. by talking and building bottom up. So one of the big themes when you see it in Uniting the Movement, which we published in January, you'll see it in the action plan. It's an expansion of our place-based work. And I think, we have some choices to make there. We need to go to the places where they're not well served by sport. They're not well served by health. And actually, we're after the same people. And so I think that's going to be really, really important. And Ollie, as you were saying, we really shouldn't underestimate the contribution. The social return pre-COVID on sports and physical activities contribution is 80 billion plus. That's massive. And actually, it's often a really cheap and effective and cost-effective way of helping people become happier and healthier, and that's what we want for everybody.
Yeah. And so just building from what you said, so much of what we've achieved to date has really stemmed from partnership working and collaboration. And I'm just interested in maybe come to you, Chris. How important has been building effective collaboration in helping you to achieve your goals, and just reflecting on some of the challenges ahead? What do we need to do going on to build and continue to build collaborative working?
It's vitally important because the resources are limited. If you look at the sport and physical activity sector, we give so much in terms of return on investment. The volunteering effort within sport and physical activity is unprecedented. And, if you take athletics and running, we're an organisation of 47 staff, £8 million turnover business, and yet we are nearly 200,000 members, 1,800 clubs, 170,000 social runners through our Run Together programmes in 3,000 leader-led groups. And we license 4,000 road races, and there are 7 million people running every week. We can only do so much. So collaboration is absolutely imperative. So working in collaboration with our partners and good friends at Parkrun and the other major event providers, the Great Run Company, London Marathon, and others is vitally important. And that will be the same in many other sports and physical activity areas of the sector as well, where collaboration is fundamentally important. But I do think we're at this crucial moment now, coming out of, we hope, the pandemic. Sport responded magnificently, frankly, with the card that it was dealt. I think Sport England was superb 18 months back when this all started. But the resources that Sport England have compared to other sectors are minimal. And the resources that we all have as partners are minimal. So we need to collaborate. We need to find a single voice. We need to collaborate as partners in terms of insight and research. And that's the way in which we will influence and leverage additional resource. But for me, sport and physical activity, I said it in the previous session, is the magic pill. But we're converts. We're in the room. I'm not sure how many CEOs are here today, from the sports sector certainly, but from other sectors, health, education, regeneration, crime prevention, we need these people to hear this as well, because it's not a new fad. This has been something that we've spoken about year after year after year after year. And it needs to change. Prevention, not cure, and sport and physical activity can be at the front. Sport and physical activity should be considered in the same breath as maths, English, and science. It should be a statutory obligation, and it should be measured. And the same in terms of local authorities as well. If it's not measured, it won't get done. So for me, that's the key challenge. That's the opportunity for all of us.
Thank you. Ollie, any thoughts on how we take forward collaboration around mental health, sports sector, and others, indeed, if we're wanting to address rising inequalities and reach new audiences? It seems that, building those partnerships is going to be crucial for that.
Yeah, there's a great story in Tibetan and Bhutanese culture called the Four Harmonious Friends. And essentially, it has an elephant, a monkey, a hare, and a bird. And it's around a fruit tree. And first they argue who knows the fruit tree the best, who should have ownership over it. And it was like, the elephant's the biggest beast. He said, oh, the tree was growing when I got here. The monkey says, oh, it was a small tree. The hare says, oh, it's a sapling. The bird says, I dropped the seed. And so they agreed, well, actually the bird understands and knows the tree. But then man comes in and he starts using the fruit tree, or they start using the fruit tree. So people come in and start using the fruit tree. And they have a problem. And so the elephant says, well, I can reach the fruit. No, I can't. The monkey says, I can climb up. No, I can't. In the end, they had to stand on top of each other. And at the top of the pyramid, the elephant, the monkey, the hare, and the bird was the bird. And the bird was able to sort of get the tree. The point being, I think as sport and then the mental health component, we're possibly the hare and the monkey in terms of size. We have to reach out to the beast that is public policy, the beast that is public sector, but most critically, the community's lived experience, that is the bird, that has the view over what at place level, what at neighbourhood level is critical, must be central to the collaboration. So if we take nothing else away, we're probably guilty of just bringing together a room full of hares. Possibly we might bring in some of the monkeys. We've got to get, yes, to the elephants, but central and at the core has to be. Now, Public Health England released an interesting report recently around embedding physical activity with NHS leaders. And one of the key findings was that those leaders of that health system really have a lack of awareness around the role physical activity, sport for development can play. So in the elephant side of the engagement, I think there's an interesting component. We've been very focused perhaps on training, capacity building within our sector. How do we reach out to both the elephant and then ensure we're listening and being guided by the bird? And the Moving Healthcare Professionals program, if you know it, 20-odd thousand trained, over 50,000 use of the tool. But the NHS is the biggest workforce in the whole country. So how do we expand that training, capacity building, those that are outside of the hare and the monkey group?
That's a good challenge, and I'm so glad. I wondered where you were going with the four of us up here. I was worried that we were going to have to role play or something. It was all going to go horribly wrong at the end, but it's a great analogy. So today we've obviously been inspired by what's been achieved by sector colleagues, a real breadth of activity that really has begun to change culture around mental health. So what would be your one thing that you would encourage delegates to do to embed mental health across the systems and cultures that they're engaging with? What's the one thing, Chris? You start.
Well, from our perspective at England Athletics, I'm looking at Liz at the back of the room. We had a chat about it after she'd facilitated that earlier session. We have an employee forum, which I chair on a monthly basis. We also have a wellbeing internal working group delivering and overseeing the implementation of our wellbeing action plan. And I think there's an opportunity for us now to just stop and reflect on what we've been doing as an organisation and just make sure, building on what Clark said earlier, is it systematic? Is the system, we're doing lots of stuff. You know, we've trained everyone in mental health awareness. We have mental health first aiders across the organisation. We give people 3 days off for their mental health and well-being, give their birthday off as well. So I was pleased to hear that earlier. And we also implement a tool once a week called Friday Pulse. So if anyone's heard of Friday Pulse, or you haven't heard of it, take a look. It's a measurement tool of happiness across the workplace. And we use that as a tool to help us as an organisation to measure happiness. So when your board of directors are saying, how are we performing, not the finance and nuts and bolts of delivery, look at the happiness as well, and you can correlate the picture more often than not. And we've also bought into a scheme called Champion Health, which is fronted by Jack Green, the former 400-metre hurdler, which is the Netflix of wellbeing. So if anyone hasn't seen that, have a look. And that's available for our staff. So we're doing lots of stuff. And the question I've got in my mind, is it systematic? Is it all connected? Or have we just thrown lots of stuff at people? And, you know, that's for Liz and I to talk about after. So.
That's great. I think we're all going to go back to our bosses and ask for our birthday off. I think that's certainly a piece of learning that I've taken away. Mike, what's the one thing you would advise delegates to go away?
So, I think this might just be two things, but bear with me. I think, and it builds on around the collaboration discussion we've just been having, I think it is, wherever possible, combine effort to avoid duplication. There is so much happening, but it's not very joined up. And saying those words, I hate those words, joined up. It's really hard, but actually us being a little less precious about who does what, where and why, combining effort is, I think, the biggest answer alongside involving lived experience. The second thing I wanted to say was, in what we're doing, don't lose sight of enjoyment and fun. Because after the last 18 months, we all need some fun and enjoyment. And actually coming out has been great fun today. But in what we do, let's make it fun and enjoyable, because when you enjoy something, you're much more likely to come back and do it a second time.
That's great, and we are stronger together, aren't we? Absolutely. Ollie, final thoughts from you on what you'd advise delegates to do if it's one thing they're taking away to continue to change systems and cultures?
I'd actually started to relax because I thought after the last story you weren't going to come back to me, so caught me on the spot. No, I would ask a question around how much of our energy and effort is focused on supporting positive mental health and wellbeing outcomes in sport and physical activity, and how much is focused on supporting broader mental health and wellbeing outcomes through sport and physical activity. And I'll explain that slightly. Across the 200 plus organisations that make up the Sport Development Coalition, they're primarily, to some level or not, focused on using sport and physical activity as a tool. Some are also focused on what we can do within sport and physical activity. And what's interesting in that group, they're increasingly measuring the efficacy of the different interventions, ideally place-based, ideally community-led, by the tools and approaches which are used outside of sport and physical activity. And I think that very much helps in terms of advocating for the role we play across the system. But equally, they have, and I hate to use the jargon because the term was used, was rightly correct, but they have a very clear theory of change, or a very clear methodology, or a very clear approach of how they're contributing to and using sport and physical activity as a tool to contribute to wider outcomes. So that would probably be the one. What levels in sport and physical activity? What levels through sport and physical activity? And if it's through sport and physical activity, let's not kid ourselves. This isn't a panacea, but we've got an important contribution to make, and being able to articulate how we go about making that contribution with clear steps from what we deliver to the outcomes that we want to see is absolutely critical. And there was a term bandied around before, we're all in this together. Well, we're not just all in this together as sport and physical activity, we're all in this as a broader community and broader society. So if we are going to play our role, yes, we've got to look in our own house, we've got to look what's in our house that we can contribute to the whole neighbourhood. So the intentionality of that approach would be the one takeaway from my side.
That's great, thank you, and hopefully that's useful tips for you, and just leaves me to thank our panel for being part of that final session, so thank you. Okay, so final words from me. It's been a fantastic day, hasn't it? It's been really, really great. And to think that there were hundreds joining online earlier, and thanks to you all for staying. Sometimes, you know, when they used to go to conferences and by lunchtime everyone would disappear off. And the final session, you'd always be talking to a much smaller group of people, well, it's really great that the room is full, and I think that speaks to the quality of the presentations and discussions and participation of you all today. I want to thank all the people that spoke and gave their time to present, a real breadth and a real richness, and really valuable. I want to thank you all for attending and for making the time and space to reflect on, reflect on the work that you're doing, and to reflect on the learning that your colleagues are doing across the sector. I want to thank our funders in Sport England and the National Lottery, for whom the foundation of all of this work wouldn't have happened. You provide the foundation for this, that's enabled us over the years to achieve so much in partnership with you. And also to the physical activity team. A special thank you to James Durkin. Where's James? He's James, well done, fantastic. It's almost... James has project managed this event on top of lots of other work that is taking place. You'll remember, this event was supposed to take place 2 years ago. So, he's pretty much had to rip up some of those plans and start again and rebuild, and done an amazing job. But the team, they're a small team, but with an enormous remit, and they do fantastic work. So we're all going to go and have a pint, well-deserved pint in a minute. Just because who said we have to have fun? Yeah, we have to have fun. We've got to do our team bonding and reconnect after so many months of just speaking over Zoom. So I hope that you will take away a lot from today. I hope you've also picked up that there are a load of resources available to you. The team and across the sector, there are reports, there are evidence bases, there are evaluations, there's toolkits, there's guides. You are not having to start from scratch. The physical activity team of working across a breadth of organisations, and believe me, it's probably, if you're thinking of doing something, someone else has thought about it before, so do make use of those. And while the mental health emergency will be deep and long-lasting, and who knows how it will work out, we can all play our role in supporting mental health, and remembering that as we move more, it's not the panacea, but it can be life-changing to many people, and we've got to keep that in our minds. So let's push some of those intentions, some of those pledges, some of those thoughts and ideas that you've had today into action. Don't forget to drop your pledge cards off, so that we can chase you up. Check that you're doing it. No, only joking. But, this is about not just thinking about what we can do, but actually doing it. So that's it, really. All it is for me to say, take good care, look after your own well-being and mental health. You are not on your own. You are part of a sector, and you are part of a larger movement that is demanding change and improving mental health. And it's been a pleasure for mine to work with so many of you. And whoever you support, whoever you work with, Mind supports you. So thank you.